With us today is Agnieszka Billewicz. She is the design director at STAR, a global digital service agency. Hi, Agnieszka. Great to have you.
Sorry, my time for introduction already?
No, just hello. How are you?
Hello, I'm doing good. Very happy to be here and extremely happy we managed to get over the technical difficulties.
Yeah, sorry about this. That's real life, actually. You know, you can't manage some of the stuff, and technology is always the trick here. And together with Agnieszka, we have Joshua D Carney, who is the Chief Digital Officer at OnDosis AB in Sweden and the company behind Oysta. Hi, Josh. How are you?
Good evening. Doing wonderful. Thank you for having me. This is quite the experience I've been looking forward to. Thank you.
It's wonderful to have you both here. And without further ado, let's look into Oysta and learn more about your work and your journey. So please take it away from here. There you go.
Perfect. Can you see my screen?
We do.
Great. Before we start, maybe one sentence of introduction about us and kind of what was our role on the project. So as we mentioned, my name is Agnieszka Billewicz. I work at STAR, which is the global technology consultancy. And at STAR, I'm a design director in our healthcare and life sciences practice, which means I lead teams that mean to impact patient adherence, patient engagement, simplify HCP workflows. So I've been a leader of the design team, but there was multiple designers involved on the project. So I'm only representing a bigger team here. And Josh, maybe a few words about you.
Absolutely. And thank you for the intro. Josh Carney. I'm the Chief Digital Officer at OnDosis. OnDosis is a personalized dosing solution company where we designed and developed a unique piece of hardware that allows for individualized dosing. We'll get into a little bit more what that is. And my responsibility area is to wrap that in as many holistic offers as possible, depending on different pharmaceutical verticals that we would enter into. ADHD is one possible area that we're currently active in, that we are active in. And there's a number of other possible areas we would like to extend our offers into.
Great. So we'll start with talking about our challenge, and I will also let Josh to start on that.
Brilliant. So how might we enable better care? When we really talk about ADHD with the Oysta, we're really talking heavily about children. Children get diagnosed between the ages of 6 and 12. And this is a very long and very difficult journey for them. That during this time, they could be a little bit outcast. They're losing friends. Their social networks are evolving and changing rapidly. Their schoolwork could be suffering. So there's a lot of different contextual issues that children could be dealing with. And this is normally raised in the US focused by their teachers. Their parents might have an idea, but their teachers start raising it as their grades start slipping, their social interactions are slipping. And then to get to diagnosis takes time. This is a long process. You're working with your pediatrician, physicians, psychologists, teachers at the school to try to find the right diagnosis for your child. This is stressful. This is a confusing time for the family to really try to nail this down. And the children are young. They don't actually know what's going on and how this could be, what's the effect. So this journey could take a couple of years just to get to the diagnosis. And then when they get to the diagnosis, now the parents are trying to read as much as they can, educate themselves. The children are starting to become aware that they may be different than their friends or their siblings. And then the big question comes, how should I start my child on pharmaceuticals? And if I do, what does that mean? And there's a lot of additional guilt that comes to it from the parents thinking about starting their child pharmaceuticals. There's a lot of complexities of understanding what is the pharmaceutical versus what's not, what is the ADHD and what's my child. There is this a multifaceted problem. And you layer on top of this, there's a number of doctors and teachers and a school system involved. This turns into a very, there's a it is a period of turmoil for some families that are really trying to find a solution that works, and that also works for their family, that works well in society, and also makes them feel good and secure that they're taking the right decisions and they're delivering the right level of care to their child. So where do we start? Well, we started at OnDosis, as I mentioned, with this device, this unique device. What it helps solve during these levels of new interactions and new ways of being is when you go to your physician, normally they would prescribe you 5, 15, 30 milligrams of a certain pharmaceutical. And there's a process when you start on a new pharmaceutical called titration. This is a difficult process. You could be cutting pills, grinding pills, going to a secondary supplier. You might get 3 to 5 prescriptions, and you're supposed to mix and match for your child every morning to find just the right, you could say, take a 15, half of a 15 and a 5, see how that goes, and you're just mixing and matching. And this is during these relatively chaotic morning processes when you're trying to get out the door, get the kids to school, you're trying to get to work. I know in my house, it's a relatively chaotic period. Does everyone have their winter gloves? Does everyone have a hat? During that whole process of trying to get out the door, you're also now cutting pharmaceuticals on your kitchen counter and trying to convince your child to take these pills. What the device does is it allows us to dose it could be every 5, 7.5, 10. It cuts this down. So the device itself doses just the right amount that you need for your child, as well as it's extremely easy to swallow. You're not talking about any large pills. It's very small BBs. And you can see this really helps in some areas, but that only takes care of 2 minutes, 1 minute of your entire life. And this is what we started to do to wrap the rest of the companion software that STAR helped us develop to really deal with all the other areas of concern and add real value to the families during their care journey with ADHD. We can hit the next one. And that's how we came up with this wonderful suite of offers that we have. Companion apps for the parents, so they have a place to interact, find information, as well as get real data on what's happening. For the physicians, there's a portal for them to interact with data, and for the teachers, a way for them to support and send information in.
So today we would also like to have a bit of a high-level walkthrough with you through the summary of our process, especially some behind-the-scene UX work, and highlight a few aha moments that really shaped all of those solutions and how we really got there. At first, when we met with Josh, we knew that we were as Josh mentioned, we had the doser already. So we knew kind of the area that we're going to work with. We had some target user groups, but we really didn't fully conceptualize yet what's going to be the solution that we want to have. So we were just looking to build a value for digital means around the doser. And we knew that the very first thing we want to do is to sit down and talk to parents and pediatricians. And that's what we did. So very first thing, we tried to understand the context of the landscape through a lot of exploratory research activities. And I think talking directly to parents and healthcare professionals through semi-structured interviews was one of the most important things, because we were able to talk to them about their daily lives, their burdens, observe some of those chaotic mornings that Josh mentioned, and really understand where maybe key opportunities lie. And we also wanted to mix at this stage the gathering of the qualitative and quantitative data. So we talked to a smaller group, but then we took the insights from the smaller group and tried to deep dive into them further and validate them through a larger survey with like 100 participants. So we were mixing and matching methods to ensure we have both qualitative and quantitative data. But they all kind of came directly, of course, through the representative target users. And to be honest, out of those conversations, which were one of the most memorable moments of the project for me, even though it was just the very beginning, we had a myriad of insights, quite a lot of things that really shaped later understanding of which direction we should go. I want to maybe highlight one example for you of an aha moment that we did. So during those interviews, for example, we had an insight that one of the biggest issues of diagnosis and early titration process is the logistics of getting parents and teacher filling out paper forms and then returning them to HCP. As you can see at the kind of bottom on this slide, this is literally an excerpt from one of our insight decks. And this insight about how tiresome and cumbersome this process is for all stakeholders involved led us to an opportunity area of creating a digitalized rating scales. And that led to a cooperation with AAP, American Academy of Pediatrics, to bring the feature of a digitalized Vanderbilt scale that can be sent for an HCP, requested, filled out directly in a web platform, and the results can be accessed again digitally for HCP. So entire process is so much easier. So we had many of the simple insights that could lead to a specific feature, but even more than just a feature, those early insights gave us an understanding that we should be looking broader than we are looking. That, for example, teachers that spend hours with the child a day are a very important part of the care team that we maybe didn't actually have in our side at the very beginning. So we went back and to the field and had supplementary interviews also with psychologists, psychiatrists, and teachers to inform. And then all of those research activities has really brought us quite a lot of understanding around the tasks that parents and a healthcare professional have, but also the problems that they currently have and the priorities that they have. And we were iteratively trying to make sense of all of this complex information that we were gathering. And we were using multiple tools. Just to give you a few examples in kind of just screenshots from our work in progress, you can see we were using value proposition canvas, we were making personas, we were documenting the treatment journey, we were comparing the competitors' features. So there's a lot of those iterative sense making that using those tools allowed us to gradually evolve the concept for the application. We really started from thinking about a personal tracker app for families to provide support and understanding of teens' comfort, enabling parents to observe the progress and visualize the results through a personalized reports. But then over time, as we iteratively synthesized, we evolved this idea into a whole comprehensive digital ecosystem that's connecting multiple stakeholders in the circle of care. So basically, we started broadening the circle of care from just thinking about parents to understanding that it's also about other guardian relatives that we have to take into account, patchwork families, different setups, maybe, for like, a care nurse, and different, really very different types of people that can help create a care circle and bring information from the home environment. We started broadening to the next level of the care circle, thinking about the school environment, and that involves teachers, special teachers, care assistants, school psychologists, and understanding that all of this needs to be brought to the healthcare professional, and that also could be multiple types of healthcare professionals, whether it's a general practitioner, pediatrician, psychiatrist, psychologist, neurologist. So throughout this process of evolving the concept, we understood that the most important thing that we can do to improve the lives of children with ADHD is to enable the kind of build up of the care team around them. And the more cooperative this care team is, and the easier kind of the communication between them. And that can really help improve the lives of families and kind of take away the burden as well. Having this concept was not the end yet. We came back to the field, and we were really looking to make data-driven decisions around this concept. So we moved back and had another survey with another 100 participants, this time including teachers and psychiatrists as well, in addition to families and pediatricians. And that really led us to a lot of valuable insights. I think the biggest really was that we were able to take data-driven decision around the feature set and understand what is the right feature set and what really responds to the priorities and preferences of all of those various stakeholders that sometimes are conflicting. Yeah? And at that point, it also, besides kind of validating the feature set, it allowed us to go deeper into certain areas to understand what kind of data HCPs would like to see, and how can we provide them this data in the best and most legible way. But those decisions that were data-driven were not only about features, they could also be about various aspects that we were really looking to get data on. So for example, we were also at this stage already testing several approaches to visual directions. Yeah, so you can see here work in progress, kind of just very different, let's say, look and feels. And you can see that the one that tested the best, that is visible on the left, is somehow resembling the final look and feel of the application, for example, for the parents. But again, it was still iterated on. It was even before we had the brand, so that was put on. But we already were able to take data-driven decision on the direction that we want to go in. So besides features, many different aspects were validated through this quant data, and that enabled us to move on to wireframing. At this stage, we were getting better and better fidelity of wireframes and getting to a high fidelity. And wireframing was really a core part of this later stage. Even though we've already had a visual direction selected, it was a conscious decision for us to try to wireframe the logic, the key flow and the logic still at the level of wireframes and not in the full UI. So while we are in the background building the design system and already having the visual direction, we're also testing with users on a wireframe level where we don't have the distraction of the colorful UI, and we can also focus on understanding the right patterns, the right data, and have that be a big part of the process. Most of the feedback at this stage was connected to legibility of the kind of visual data visualizations, but also most importantly, most of our discussions focused on what kind of data to show to the HCP, how often should it be tracked? Because as I mentioned, sometimes those priorities can clash. So in the service, we knew that HCP would like to see a whole lot of data, ideally tracked multiple times a day with multiple metrics, but we also know that the parents were already feeling overburdened, and requesting them to, for example, track 100 metrics 5 times a day probably wouldn't result in them at all adopting a service like that. It wouldn't make their lives easier. So a big part of our thinking here was how to get to what's the most important things that we need to gather, how often they should be tracked, and how they should be visualized. And of course, as we were doing that, we were still iteratively validating both the wireframes and the later UI with parents and with healthcare professionals to ensure we catch any usability issues that we might kind of have at in the process, and that we iteratively kind of get to the most successful outcome that that can really help all of those stakeholders reach their goals. And it led us to what I will walk with you now as a final solution. And throughout the design and development of the final solution, we were focused on addressing the unmet needs of all of the people that can be connected throughout this service. So with the Guardian app, that most likely is being used by parents, but also, again, all other guardians connected, we wanted to make sure we are relieving the overburdened parents and introducing features like automated tracking or automated medication reminders. So there's not yet another thing that they do have to remember about. And also giving them just a means of having a more informed conversation with a physician, from what Josh kind of said at the beginning, where you have paper forms that might be something that you forget about, and then you, oh yeah, I have to bring it to the teacher and come back, and then I don't really know what's the result of that, what happened. And all of this kind of overwhelming amounts of information can be moved into one place where you can have kind of a simplified overview of all the observations and tracked results, and give you an overview of how your child is doing. In the HCP portal, we focused on trying to address the unmet need of the consistency of monitoring and being able to bring data from what happens in between those visits to the HCP office, and giving them a more unbiased and direct way to get the data from both the parent and the teacher, and having a very simple workflow that doesn't rely on the cumbersome paper trail. And finally, within the teacher's portal, we really wanted to ensure that the teacher is taken into account as part of the care team, and give them a way to easily give us observations and share them directly with HCP as well, and in an easy way fill out those digitalized rating scales as well. So that would be a very quick walkthrough for our process and kind of what we ended up with. I will stop sharing my screen now so we can get to possible questions from the audience.
Right. Thanks a lot for this quick insight. And I guess there is many questions that we can address. And if you've got any to Agnieszka and Josh, then please bring them in now. You can send us your questions for the event comments, and I'll bring them in to the conversation. First off, from my side, a little bit to frame this whole space a little bit, Agnieszka and Josh, can you describe very briefly about the market in which Oysta is moving, like where the product is situated? So what is this whole business model? What is the business model maybe, and what you address, and where do you fit in within the whole healthcare and system?
Absolutely. So the target market is the United States. We hope to launch in 2027, barring the FDA approval of our solution for the drug combination device. And we may launch earlier the digital offer because it has a number of its own legs to stand on. It's the US, and then we'll roll out to Europe post that at the appropriate time. The combination device, the physical device, will be a reimbursed good through a normal prescription plan that you would receive. Then the application base to the parents will most likely be freeware. And we're investigating what's called DTCs, for reimbursement RTM. Sorry, that's something else. RTM.
Too many. RTM? Please talk in plain
remote remote therapeutic monitoring. This is another reimbursement channel through the healthcare providers in the United States that then the time the physician spends within the digital offer, they'll be reimbursed for their time. So we're really trying to make the offer as reimbursable as possible, as well as making everything as simplistic as possible as well. So low time burden, easy access, as well as reimbursable. So that's our current methodology.
And in terms of USB or other products in this space, is it something new that you've developed, or maybe in the scope of what Oysta offers?
I would say in the total offer, we are very unique in the sense that the flexible dosing for titration is very unique in the marketplace right now. Being able to change doses day to day, multiple times a day, up and down, and matching that with a complementary service that provides great information and relieves pains to both the family, not just one family member, but the greater care circle around the child, as well as linking in the number of different physicians to the same data set is a very unique offer right now in the marketplace. Not saying that there isn't any other players that have offers similar, but I would say identical. We will be the only ones in 2027 with this offer.
Thanks. Yeah, I find this very impressive how you addressed the stakeholders. As you said, Agnieszka, I like this very much, this care team. So the whole environment of people who are around affected children. Agnieszka, can you briefly frame the duration of research? How long did it take to develop Oysta? And what phases did you have in the development process?
Yeah, it actually took quite a while. So the slides that I was showing with like 3 phases of research, like they were actually encompassing our entire, I would say, research journey. But in general, our partnership with OnDosis is quite a long-term partnership. So we were doing some activities before we were working on the concept of this exact product that got designed and developed. Yeah. So we had some activities before, we had some activities after. But overall, it's just a standing long-term partnership that spans quite a long time. I can tell you that, for example, each activities, like the early activities, was around like the 3 months, I think, from starting the exploratory research to very first concept. Yeah. But then during the development, that was much longer, of course, over a year, we were also having those iterative research activities. So it was very flexible, and similarly the design team. There was moments when we had 3 or 4 people in the design team because we were in this highly kind of conceptual moment where we also had, separate people working on the design system, separate person, for example, working on UX. And then, for example, as we went down and we moved further into development, we narrowed down to 1. So the overall time is quite long, but the intensity varied between phases.
Right.
I think it's also fair to say that we've pivoted once or twice as well.
Yeah.
So I think that though the solution has pivoted, I think the core research and the core methodology has held true for the engagement. And it's been a while. It's been a long engagement, but I think it's clear to say that it's when you think you figured it out, I think we found great evidence to pivot and kind of break down what we have and start back over, which has been nothing but a great experience.
Well, I think it's the way you put it down sounds almost too good to be true. We all know that if when a project starts to grow, and Agnieszka, you mentioned you set out with a different idea that it would be. You said, I think, the doser and a personal tracker app, and it evolved into a digital ecosystem. So that means something in terms of budgets, timings, processes. How did you address this in your partnership in order to not create any fissures or difficulties?
So I think the important thing is the milestones. Yeah, like I don't know if you would agree, Josh, but I would say even though the partnership is long term, obviously we have milestones that we reach. Yeah, and every single thing that we were agreeing to do was basically like a package. Yeah, so even if we, for example, at the beginning, even before we got to this personal tracker, for example, concept, I think it was like first 3 months. Yeah. That was the milestone. And then we were saying, okay, go, no go decision, do we go this direction, do we pivot? And then we would, sit at the table again and discuss just kind of peer-to-peer, like what that would mean if we pivot, what would be the impact on the timeline, on the budget, on everything. And kind of those milestones kept us in check, I would say.
I completely agree. And I would just like to add that the approach with us being very data-driven has helped a lot in the discussions. It makes it less about how you feel, about what the data says. It helps very, very much when we were discussing expanding the offer from a tracker to a more of an ecosystem offer. That understanding that, yes, it may be a more expensive project, but the actual offer is addressing so many more pain points. We are really capturing a real true market need. Then that gets into a very different type of negotiation, rather than it's talking about who are we and what's our ambition, rather than how many nickels are we going to rub together to get this done. And I think that was very elegantly handled during this engagement.
Well, I think it's also bold on your part from a client's point of view that you went along with the growth and you saw that there is promise in a new let's say expanding business field, which can't be all about data. It's also about seeing facts and having the intuition to follow them. So there is, I guess, a balance between data and boldness as it's all involved in developing business. There is a question from one of our listeners, Laura, and I think that it matches a little bit of what we've been touching upon. Mm-hmm. And she asked, how do you balance business and user expectations? So it's two elements with the real findings from research. Anything you can comment on this?
Yeah, I think this has been a very good journey. Just to note, there is a third partner with us, and we all have very different ways to do business. And that collaboration was at times, we'd say, very heavily discussed on many topics. But I think the balance comes down to, again, I would just like to bring it back to the offer. Who do we want to be and what do we want the offer to be? And then we are lucky enough to be able to find the right level at which to define the offer. We all know, I think we've been in the industry long enough to say one feature can be an extremely deep, extremely complicated feature, or we can make this feature thinner. We can make it lighter. And I think this was a part of the negotiation. As an example, around the teacher application, we had a number of rounds of negotiations on how complex and how deep do we want to go into this particular element of the offer. And I think we landed in just the right place by these deep data-driven, research-driven points, as well as more emotional. How do we want to play? Who do we want to be, and what do we want to offer?
I would also, I think, mention the incredible team, because obviously me and Josh represent two, let's say, different backgrounds. But besides design and technology, there's obviously product managers, product owners. We worked with an incredible team that really, I think, understood that product roadmap is something that is a live document that evolves. And this is the kind of way of addressing and kind of balancing business and research. So within research, for example, we would try to make sure that we don't lose anything. So we have like a huge hypothesis retention sheet where you have all the insights that from all of those various research listed. Are they validated? And then it was also a question of, which of those insights are we prioritizing to address first? And that's kind of how business, I would say, impacts research, because research just brings kind of data, and then we can, based on the business needs, address some of those earlier, some of those later in the roadmap. But kind of just us trying to make sure everything is kind of, the process allows us to document all of those insights and not lose them, and build in each phase of the project, maybe build on different insights. And I do still think there's some insights that we have left, even from this initial research, that we hope to build on in the future when we evolve.
Yeah, the backlog is rich with a lot of value still sitting on the table, waiting for us to take the next step.
Right. So this is about not only data, but also fact-driven decisions. And as you said, Agnieszka, moving forward iteratively, going back to discussions, evaluating, I think being clear about how you prioritize and where you set priorities is also very important in order to move forward together, right? So this is really about having a transparent and communicative joint process, and as you said, facts to back up decisions. Going back to the solution itself. Your goal is to bridge the communication gap between healthcare professionals, parents, teachers, in order to support children, since they are these three groups are like the stakeholders in the care group. So are there any main or secondary users for Oyster, or are they all on the same level?
Should I go ahead?
Yeah, go ahead.
From my perspective, and I hope that we are aligned, I think our primary group is the parents. Yeah. So we're trying to empower parents to build the care team around their children, to enable them with information, enable them with access to tools that can help in healthcare. We have something that we call patient activation, that is both a myriad of both patient education and patient kind of feeling of confidence in managing your own health. Yeah. So we're trying to raise that patient activation level within the parents, enable them to have an informed conversation with an HCP, not saying that an HCP is in any way secondary. But I think there's a huge difference between professional users and non-professional users. Yeah. So obviously HCPs are already a bit better equipped, yeah, to handle conversations around health. They're professionals. So we do have primary and secondary groups, but they're very close to each other. If I were to say maybe secondary is how we're enabling those multiple people from the same environment. Yeah. So maybe we have one primary, for example, guardian, but we also enable multiple secondary guardians to be added to the care team. So in that sense, in each of the environments, we have primary and secondary user, because you can have the person who is most kind of benefiting from the solution, and the person that is more kind of just contributing from time to time in each of those three environments, whether it's healthcare, home, or school.
And I would just like to add to that, also when we're talking a little bit about the communication, it's also the timing. So for a lot of times for the visits to the physician, you're looking at the physicians, depending on what kind of practice they're running, they have about 15 minutes to talk to the child, talk to the parents, and get information. And these visits can be spaced 30, 60, and 90 days apart. So when we talk about enhancing the communication, it's also about enriching what's actually being shared during those conversations. How I look at it and how I always reflect on this is I try to remember what my child had for breakfast 5 days ago. I couldn't tell you. I know they had breakfast, but I couldn't tell you how much did they eat, what did they eat. And this is the level of information that the physicians need over a 30-day window of, okay, so your child took their medication every day of the week. Of course they did. We know that we miss. You know that you might have missed, but mostly you did it. How did they respond? Well, that's where this being able to be having the evidence, having the information to facilitate these conversations, as well as the physicians do call them, like physically call people on the phone sometimes. And then if having the information actually enrich that conversation, that quick touch in to say, how is titration going? How is the care going? What's happening? To get a little bit richer interactions, to get right to the core of it, because they may need a prescription change. They may need an actual
This is
care.
all part of Oysta, that this co-communication between parents, medics, and maybe feedback from teachers is included, and you're also nudging these 3 groups to provide the information that's needed for the other ones.
Mm-hmm.
Is that right to frame it that way?
I would say nudging's a fine way. I wouldn't say it's much more than a gentle nudge, in the sense that everyone's very busy, I think is a very thing. And we know about notification blindness. We know that if we push too hard, you're more likely to drop off. But I would say from the core of the, we'll say, literature reviews, that education for the parents, information really helps them, data and information, seeing how things are progressing and getting access to materials really drives their adherence, and their adherence to the treatment as well to the solution. So we really believe that we have something magic there. And then the physicians, it's more of in their processes to nudge. It's in their interest to nudge the patient along to get to high quality of care, because that's who they are. That's what they want to do. They want to care for their patients. So I don't think it's not heavy nudging, it's light nudging.
So is there, in terms of information, you're providing information. So I think in this case, trust and where the information comes from, the sources, is pretty vital. So how do you go about building trust with parents who might have had many people telling them different things and many things they might read? And I think this is a key there.
And I believe one of the key things that has really enabled us here to have trusted sources is working with AAP, working with the society, this association of physicians, is really key. They have great index of information and literature, as well as the Vanderbilt scales, which the physicians and the teachers both rely on. The parents, they may be newly introduced to it as their child is just newly diagnosed or been on the care journey for a little while. But many teachers that are tenured, all the physicians know about these rating scales. So to them, that automatically builds a level of trust that you're supplying trustworthy information. We're not trying to invent something new. We are truly driving towards what the industry standards are, as well as providing the parents with good referenced information. And this is also part of the journey that we're on. We'll see how far along we go, but get more into the medical device approvals on that side. And as we move down that journey, that's also a good trusted mark. If you're approved by the FDA, you are a good product.
Maybe a final question. I mean, like, it's something we probably can't hear anymore, but of course the AI space is still the buzz here. And also we in the UX Design Awards, year by year, we're getting more and more submissions. I think by now most of them claim or prove to be enhanced by AI. And the key there always is, well, how does technology actually support users? Does it support? So what's the reason behind it? Is there any terms of artificial intelligence, machine learning functionalities involved in Oysta? If not, why? Or would it make sense?
I would say that the ambition, and when we talk about this excellent set of features that are still sitting on the table, we have a number of features that are AI enabled and driving a much better, we'll say, offer or experience, especially towards the parents, as well as once we are further down the road and we have more data in, real data from patients actually using the solution, what our machine learning will be right hot on those heels, enhancing the physician's interface to really give them deep insights. We're still data light for getting more into machine learning, but for the AI solutions, a little closer to the LLMs, we have a number of great ideas and concepts that we want to dive into in a short order. But we wanted to make sure we had the foundation clear and clean, and that the core of what we want to offer is solid before we start enhancing that offer.
Right, which is also connected to building trust, because you build valid information and not source it from the web. Agnieszka, what you're probably somehow also in the know, and of course through your work up to date on what would change design-wise if you build more. Let's say, depends, of course, which kind of AI-based functionalities, but what would you suggest as the next steps in terms of interaction in Oyster in that sense?
On any level, or are you asking specifically about AI-enhanced features?
Let's say on AI-enhanced functions, and depends on what they do, of course.
Sure. I don't know how much I can tell, because there's so many, as Josh said, we do have certain ideas and concepts, but obviously they're all confidential. So I don't want to say much about kind of the future plans around that.
Obviously.
I do think we have
on a general level, maybe on a design level, compared to comparable solutions you're working on. My question more relates to what interaction patterns, what possibilities, what does it mean design-wise?
I can tell you what we are doing in generally what's happening in the market and what we are seeing in the field, that generally in solutions like that, obviously there's a huge opportunity in seeing more predictions and analytics enhanced features. There's a lot around interactivity and education related features. And also just simplifying, I think there's a lot that AI can help with when it comes to preparation for the appointment itself. Because again, right now we're very simplified. We're just creating reports. We don't get into like mini interactions, kind of how to prepare best for the appointment itself. But I think there's a huge kind of area there that can be that is still a big opportunity area, especially for those AI enhanced features.
Mm-hmm. And probably also in conversational wise interaction, I guess, as well. So from a user's perspective, would make the interaction much more fluent and intuitive. A lot of future potential. I hope that winning the UX Design Award helped you along. I don't know what your idea on this is. What did it mean to you? And so what's next apart from FDA?
I think it was a very rewarding feeling, because as we said, it's been quite a long cooperation. And it was just great to see kind of the first time something that we've been working on, kind of hidden, go and out to the world and see the first reactions, and the reactions being so overwhelmingly positive. Of course, we had the positive reactions from research, but of course, there's the confirmation bias. That's research. You always have kind of this I think anticipation that for what's going to be the market's reaction, and the completely kind of unbiased reactions without any context. How are people going to react? So it was just incredibly rewarding, and I think it was a perfect moment kind of as well, that kind of is really a milestone also in the process of development. So we've wrapped a certain milestone, we had a really huge boost and a recognition and a confirmation. Of course, we know that what we're doing is worthwhile, but it was just a reminder that it's going to be real and it's happening, and it's well going to impact lives of millions of children. So I think that was a huge kind of amount of energy for the next chapter of the journey. Josh, what did it mean?
No, that was beautifully said. It's hard to follow such a beautiful statement. I would absolutely agree with that. I'd say from the business side, the UX Award is, I think, bolstered the confidence of a number of people in our network that we're doing the right things, that the gamble they took a little bit on us extending the ecosystem was a good gamble. And I think it's giving a lot of positive boost to, we'll say next level of testing and research, either in usability studies, formative, or moving into pilots. Some level, maybe not all the way to clinicals yet, but start to get more real user feedback for a longer period of time. That is definitely on the tick list of things we'd like to accomplish in short order. Riding on the back of this great award, it's really given a lot of boost, both internally, I think, in our networks, but also into the networks of investors and supporters on the next layer out. So it's been a great thing for the business.
Well, that's very good to hear, because that's actually the aim of what we do, and it's recognizing, and it's recognition by experts for great work, and we really hope that this helps you on your journey and in the development. And of course, it is a recognition for everybody who works hard on the product. So Agnieszka and Josh, it's been wonderful to talk to you, and thank you for offering some more like deep insights and information about what Oysta is about. It was great to having you.